Hi, Assalamualaikum to Madam Hidayah. My name is Izzatulhusna binti Mohd Bilal from 3B S1G1. In this video, I will briefly explain about my general research paper, which titled An Overview on Audio, Speech, Signal and Language Processing for COVID-19. An overview on audio, signal, speech and language processing for COVID-19. In this general research paper, it focuses on the effort taken by the research community towards helping individuals and the society in the fight against COVID-19 using speech signal processing. It also summarized the deep techniques used in this direction to come up with the capable solutions in the short span of time. It further gives overview of the contributions from non-speech modalities that may complement or serve as inspiration with respect to solution usability, challenges, the significant technology achievement. In the introduction, the unique symptom of the virus and the human immunity towards it are still found to vary from person to person. Due to such uncertainties, it is advisable not to completely depend on the digital sensing to diagnose the virus, where many false alarms that AI-based diagnosing would generate. However, looking at the huge number of cases, detecting early indications will help reducing this count. Not only does identification and monitoring need digital assistance, but also the post-trauma phase. The authors in this research paper have already discussed about the opportunities, possible use case, and the challenges that remain in the speech and sound analysis by artificial intelligence to help in the scenario of COVID-19. Not everything that can be developed can be used in this scenario, considering other factors such as social distancing and personal and environmental hygiene. Screening and diagnosing for COVID-19. Screening gives an early indication of the presence of the disease, and diagnosing confirms the presence of disease. There are a different algorithm using audio processing for screening and diagnosing for COVID-19. The first algorithm is the cough detection. Cough detection is to identify the cough sound and differentiate it from the other sounds such as speech, laughter, and COVID-19 specific cough. This requires to collect the COVID and non-COVID cough sound samples to develop the AI model that can differentiate between them. The audio samples collecting are done by the Carnegie Mellon University and the Cambridge University. Both of them provided platforms for a population to upload their cough sounds along with additional information. These samples are needed to build their machine learning algorithm for identifying COVID-19 cough. Number 2, we have the breathing analysis. We know that the shortness of breath is one of the symptoms of the virus, so the smartphone apps are designed to capture breathing patterns by recording their speech signals. An attempt to correlate high-quality speech signals captured by two nexus respiratory inductance plethysmography belts over the rib cage and abdomen to measure the changes of the sample rate of 2 kHz. And not only that, blow sound can also help in performing spirometric tests. The authors have developed a smartphone-based automatic disease classification application built around the spirometric test. Number 3, we have the chatbots. Microsoft and CDC have come up with a chatbot named Clara for initial screening of COVID-19 by asking them questions and capturing the response. Siri from Apple is also updated to answer the variation of the general question based on the WHO guidelines. And not to forget, Alexa is also updated with answering COVID-19 screening question. A significant step has been made by the Symptoma, a web-based chatbot which can differentiate 20,000 diseases with an accuracy of more than 90% and can identify COVID-19 from other diseases having similar symptoms with an accuracy of 96.32%. Number 4, we have chest X-ray. The multiple efforts have been made using chest X-ray. However, as stated by the Rubin, a multinational consensus is that imaging is indicated only for patients with worsening respiratory status. It is advised for only those patients who have moderate severe clinical features and a high pretest probability of disease. As concluded by Wang, the chest X-ray findings in COVID-19 patients were found to be peaked at 10 to 12 days from symptoms onset. On the positive note, this approach can help in speeding up the diagnosis. Monitoring. This section describes the monitoring tools developed for the COVID-19 scenario include the precautions for stopping the spread of virus like social distancing, wearing masks, and maintaining respiratory hygiene at public places. The first algorithm, we have the face mask detection from voice. We know that while collecting cough samples without covering mouth, it can lead to further spreading the disease. So, this year's InterSpeech 2020 Compare Challenge features a mask detection sub-challenge where task is to recognize whether the speaker was recorded while wearing a facial mask or not. These algorithms serve as a pre-step for other speech processing algorithms such as speech recognitions. Number 2, cough and breathing analysis. Doctors need to monitor the cough history of patients, and in order to record the COVID-19 specific coughs, one monitoring application is developed by the FluSense platform, a surveillance tool to detect influenza-like illness from hospital waiting areas using cough sounds by Forza Al-Hussein. Continuous monitoring and identification of abnormalities from breathing rate has also been done using image processing by Yunlu Wang at Sierra. Number 3, we have the mental health, emotion detection. This disease has equally affected the physical and mental health of the individual, which, due to plenty of mandatory precautionary measures such as social distancing, work from home, and the quarantine procedure, which usually takes at least 15 days for the patients to be alone. As stated by Patel, the COVID-19 pandemic has generated unprecedented demand for telehealth-based clinical services. And a study conducted by Han on the speech signal of COVID-19 diagnosed patients, the behavioral parameters detected from speech includes the sleep quality, fatigue, and anxiety, considering corresponding self-reported measures as ground truth, and have achieved an accuracy of 0.69. Number 4, face mask detection of image. WHO suggested to reduce the chance of getting infected COVID-19 is to wear a mask. A mathematical analysis presented by Akenbury suggests that wearing a mask can reduce community transmission and can help reduction in the peak death rate. The authors of Wang have provided a mask face recognition data set for the detection of masked and unmasked face using processing techniques. They have achieved 95% accuracy in recognizing masked faces. And for the awareness, the speech recognitions and synthesis algorithm have been widely used in the development of the chatbots to provide human-like interactions. Chatbots are helping in spreading valuable information about COVID-19 to end users. CDC has been encouraging recovered people to donate their plasma for development of blood-related therapies. For collection of plasma, Microsoft has developed a chatbot to gather information and help them know their nearest donation center. And for the next step and challenges, a major challenge given the society distancing norms is getting the relevant and accurate data for developing machine learning models. The authors of Minor Laranjo have expressed both positive effects and drawbacks associated with using chatbots for sharing the latest information, encouraging desired health-impacting behaviors, and reducing the psychological damage caused by fear and isolation. This shows the need of accurate and reliable screening and monitoring measures at public places. And as conclusion, there is still need of context-aware designs of chatbots, although having the largest possibility of use case, as most of the first-level symptoms are related to respiratory system. Continuous monitoring of the patients using audio signal processing-based technique can assist the clinician and healthcare provider in providing services. It's most likely to be the most promising avenue of future efforts where 3 modalities, audio and speech, text, and image work together in creating the solution framework. That's all from me. Thank you.